Good morning, dear experts and members of the House. I'll be presenting our findings of the ocular surface microbiome in patients with breast cancer. We all know that ocular surface microbiome is a paucibacterial microbiome as compared to the gut microbiome and the buccal mucosa. Its dysbiosis can lead to ocular disease, and it is commonly deranged in patients with dry eye disease and meibomian gland dysfunction. With this in mind, we studied some patients with breast cancer who have been reported that there's a lacunae in literature of their having ocular surface problems and disruption of their ocular surface. So patients on systemic therapy for breast cancer were included with the rationale of studying their ocular surface microbiome and a non-invasive way to study their dry eye disease through the ocular surface analyzer. So the primary aim of the study was to characterize the ocular surface microbiome in these patients undergoing systemic therapy in the form of chemotherapy, hormone therapy. And the secondary aim was to do ocular surface microbiome and correlate with the dry eye parameters, including ocular surface disease index questionnaire, the non-invasive breakup time, lipid layer thickness, tear meniscus height, and meibomian gland dysfunction, including meibography. So patients of breast cancer were recruited from the surgery department of All India Institute of Medical Sciences, New Delhi. They underwent a comprehensive ophthalmic examination, including a complete dry eye workup. Conjunctival swabs were taken from the inferior conjunctival fornix to isolate DNA, and then ribosomal RNA sequencing was done, and bioinformatic analysis was done to find out the metagenomes present in the ocular microbial flora and to determine the diversity and their richness in the conjunctiva. Nearly all patients fell in the age group of 39 to 70 years. They were basically from two stages of the disease, stage 2 and stage 3, and there were equal distribution of the treatment naive group, the hormone therapy group, and the chemotherapy group. When we looked at the dry eye parameters, it was surprising to note that the non-invasive breakup time was deranged in all the patients. It was less than 10 seconds. All patients did present with some degree of meibomian gland dysfunction. The tear meniscus height was also disrupted, and they showed an evidence of low lipid layer thickness in these eyes. So these were the objective findings that we picked up, and on meibography also there was a meibomian gland loss. So when we studied the ocular surface microbiome, the three groups that were studied were the chemotherapy group, the hormone therapy, and treatment naive, that is NT group. They showed all a richness, increase in richness, but the chemotherapy group had a decrease in the count of bacterial load and also in the diversity of the microbiome that was present, as is evidenced by these three charts. So the NT is the no treatment or the treatment naive group, HT is the hormone therapy group, and this is the chemotherapy group. The chemotherapy group depicted that there was a staph epidermidis rich microbiome with an increase of Klebsiella and Corynebacterium, which was not seen in the no treatment group, where there was a decrease in staph epidermidis and an increase in a virome genome, which is lymphocryptovirus human gamma 4, and this showed that chemotherapeutic agents actually change the microbiome and decrease the richness. So to conclude, the ocular surface microbiome profiles of patients of breast cancer under treatment show a core community which treatment, and there is a shift towards a dry eye disease composition, and patients receiving chemotherapy had reduced ocular microbiome diversity dominated by one genus, that was staph epidermidis. And all therapies do impair the ocular surface that could be related to the ocular surface disease that is present in these patients. And these findings could then be used to develop longitudinal cohorts with pre and post-treatment sampling. And more functional studies are recommended to determine causality. And we could explore the role of microbiome-targeted therapies to improve the quality of life and decrease the dry eye and ocular surface symptoms due to this disease and the therapy. Thank you.
This very unique study. So now coming to the average age was around 60 years.
Yes, sir.
So the phyla, the bacteroids and the prevotella. So prevotella increases after 60. So, because of the chemotherapy, was there any variation in these phyla?
Yes, so usually the main constituents of the core ocular microbiome in normal flora is usually Corynebacterium, and here we saw more of Staph epidermidis, which more or less corroborates with patients who have dry eye disease and meibomian gland dysfunction, and they were less diverse as well. So probably the chemotherapy reduced the bacterial flora because they have a direct impact on the microbial flora. Other patients, like on hormone therapy, showed a more diverse microbiome, like we do see in dry eye disease and limbal stem cell deficiency also.
And did you consider the role of diet or the FMT when they deranged this RNA sequencing in the extreme of the dryness?
Role of diet?
Diet, yes, of course.
Yes, the role
because
of
gut microbiome does
yes,
affect.
So this is the ocular surface microbiome,
I got
and diet may have a role, but these patients were all similar age group. They were postmenopausal females. That definitely could be a confounding factor.
Any more question?
Thank you.
Very unique study.